Hi everyone, this is a video about using, or rather, this is a video about whether one can treat chronic infections while they are using steroids. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So, great question that somebody posted on one of my other videos, and it's something that I've certainly thought about a lot, but I haven't really heard this discussed elsewhere a whole heck of a lot. So I'm glad that this question came up. So can a person be treated for chronic infections while they're on a steroid? Now, again, not giving specific advice to the person asking the question, but in my practice, I've had lots of patients over the years who have been on steroids while we're treating chronic infections. Those patients might be on chronic steroids because they have an inflammatory condition like polymyalgia rheumatica, which, steroids are typically the mainstay therapy for folks with that condition. They might have a chronic breathing issue like chronic asthma or other forms of COPD where they need to be on steroids on a semi-regular basis. It's not usually, there are other medications that will manage that well, but I've had a few patients where they just need to be on chronic or recurring steroids. And then there's other patients where if they're having, say they have autoimmune conditions, they may need to be on steroids on a semi-regular basis for some reason. So I have quite a bit of experience with folks who have chronic infections and they are also on steroids. The steroids I find are kind of like a double-edged sword in a way. They're very good from the perspective that they're really good at shutting down inflammation. And some patients actually find that a lot of their, or some of their significant chronic infection-related symptoms, particularly pain, can really improve. Sometimes brain fog improves. Sometimes energy levels are better on steroids. So sometimes it can actually be really quite an asset for those chronic infection-related symptoms. But then at the same time, of course, steroids do have that unfortunate, pesky side effect of being suppressive to the immune system, which of course is kind of counterproductive when you're trying to kill an infection. However, as I've talked about in other videos a number of times, the way that these chronic infectious microbes like Borrelia, which causes Lyme disease, or Bartonella, Babesia, Mycoplasma, Ehrlichia anaplasma, etc., they work not only by causing issues in and of themselves, like from a tissue damaging perspective, where they're kind of like in the tissues, creating inflammation there, attacking the tissues, damaging the tissues, but they also flip this, flip the switch on the immune system where they are putting the immune system into more of a general inflammatory mode. And so in that case, the prednisone can be helpful. So again, a little bit of a double-edged sword, but in my experience, I really haven't found steroids to be a big roadblock to people getting better. More often than not, they're actually quite helpful because they keep symptoms at bay. Now, there are going to be exceptions to that. It's not a hard and fast rule, but generally, I have not found steroids to be a insurmountable roadblock, and more often than not, they seem to be helpful. We do, of course, have to be a bit careful to make sure that we're not working with things that are going to interfere with the way that the steroids are working, but there's, at least from a natural, like a non-pharmaceutical, I should say, treatment perspective, there's really not much out there that's going to interfere with steroids. So thank you for the question. Once again, very interesting topic. I will not be posting as many videos over the next week because I'm taking a week off for the holiday season, but I will probably post some things on social media. I have a little bit more free time, so maybe I'll actually post some non-videos for once. And yeah, but anyways, I hope that if you're watching this prior to the holiday season, I hope you have a wonderful, lovely, joy-filled holiday season. If you're watching this after the holiday season, I hope you had a wonderful, joy-filled, happy holiday season. So thank you for watching, and until next time.